Okay. Well, good afternoon. I would just like to open with a few comments. Firstly, to state the rather obvious that we have learned a lot since COVID-19 began, and we continue to learn daily. The events of these past 2 weeks have demonstrated that our focus on mitigation and containment has been very strong, that our protocols are very strong and effective, and we've done a very good job responding very thoroughly in what has been very difficult and challenging circumstances. So our healthcare professionals have responded to the call, and thankfully, because of these efforts, we were able to contain the most recent flare-ups. And that certainly, as Premier, gives me confidence, and I hope it gives all Islanders confidence that the protocols that we have in place are very strong. As Premier, and I know Islanders share this view, that Prince Edward Island, under the leadership of Dr. Morrison, Nurse Dowling, and hundreds of healthcare professionals, have been leading the country in terms of our positive and thorough response in this global pandemic. I am thankful to be working closely with such wonderful, talented, and dedicated professionals, and I am grateful and have been grateful for their efforts from day one, but particularly so during these past 2 weeks. There has been lots of talk and numerous inquiries about the region moving to a Canadian bubble. While those conversations continue at a regional level with CPHO officials as well as at the Premier's level, our province has been consistent with our decision-making process and our desire to follow the best science, data, and public health information as we move towards decisions. While I, like all Islanders, look forward to a time when our lives can return to some kind of normal and where our borders can be open to all of our visitors, we recognize that we need to remain vigilant as we learn to live with COVID-19. We need only to look at events around the world and in this country to understand that COVID is still with us. We have indicated that we would need more time to review public health information and the best public data before such time as we would proceed expanding beyond the Atlantic bubble. We recognize that other provinces may choose to begin expanding the Atlantic bubble sooner, as is their jurisdictional right, but P.E.I. for the time being will maintain the status quo and measure any future decisions based on the best information and data in coordination with the Chief Public Health Office. In addition to that, we have other priorities that we need to deal with prior to looking at expanding the bubble. As we have indicated in the past, the CPHO has been working with the long-term care community to begin increasing visitations for our loved ones, allowing closer contact with loved ones with the use of PPE, as well as looking to accommodate off-site family visitations when it can be safely demonstrated. Every Prince Edward Islander has been impacted by COVID, but perhaps none more than those loved ones who are living in our long-term care facilities. We have been working for a number of weeks now to look at bringing changes to the visitation process forward while working with the long-term care community to maintain the highest level of precaution for those our most vulnerable citizens. And Dr. Morrison will be able to share a little bit more information on this in a moment. Secondly, we know how much family means to each and every Islander, and those family members living outside of the Atlantic bubble who have not been able to return home and to family as they have in other years has been an ongoing issue and concern for us. CPHO has also been working to look at how we can make some changes in this regard to allow for family reunifications within Canada while utilizing the 14-day self-isolation plan that we have been using in other aspects of travel to the province in recent months. And while we know this isn't perfect, we hope in this difficult time it will present an opportunity for our family members to get home and to safely visit with loved ones, albeit recognizing that it will be much different than it has been in years past. As I say, these are key priorities for me as Premier, for us as a government, and I know that they reflect the interests of Islanders. And I feel it is our ultimate responsibility to ensure that these issues are the key areas of our focus at this time before we look at expanding our province's borders beyond the current Atlantic bubble. As always, we say for some, this can't happen soon enough. For others, it can't happen slow enough, and we recognize the views of all islanders. But we are trying to follow the best science and information and to do what is in the best interest of all islanders, and that has been our focus to date and will continue. With that, I will now turn it over to Dr. Morrison for her daily update and some further information.
Thank you, Premier. Good afternoon. So around the world, there are almost 14.7 million cases of COVID-19. And in Canada, there are over 111,000 cases, but 88% of those Canadian cases are considered recovered. But the last week saw an 18% increase in cases in the country compared to the previous week. And this increase is concerning. We saw some increases in British Columbia and Alberta. 65% of the new Canadian cases are in people under the age of 39, and the increased incidence of COVID-19 in the younger population is worrisome. COVID-19 continues to accelerate globally, and the World Health Organization continues to warn that we have not seen the worst of COVID-19. And we remain concerned when we see the numbers of cases being reported in the United States. The U.S. set another daily record for new cases this week with 74,710 cases on July the 17th. Here in P.E.I, there are no new cases of COVID-19 to report today, and 33 out of our 36 cases are considered recovered. So we have 3 active cases remaining. All active cases are at home or isolating, and no one has been hospitalized. There has been one public case this morning identified, and I want to clarify that he is a P.E.I. resident, and he is, the case no longer requires, is not posing any risk from a health point of view. The follow-up testing of QEH patients and staff who were contacts of the 2 confirmed cases is now complete. The second round of tests were all negative. In total, approximately 850 tests were completed in relation to the QEH cluster of the 2 cases announced on Monday, July 13th. The past 18 days, a couple of weeks, have been stressful and worrisome. The first cluster of cases resulted in a potential threat to residents and staff of a large long-term care facility. The second cluster involved a healthcare worker at the QEH emergency department and a patient. In both cases, we were able to identify a connection between the cases. These situations highlight our long-term care and acute care sectors are vulnerable to COVID-19. And just as we have seen and heard of facility outbreaks in other provinces, we too are vulnerable to COVID-19. The fact that both of these clusters have been contained at this point speaks to the excellent action of the health system and the ability to communicate. Our health system was challenged, and the response was effective in limiting the spread of COVID-19. Contact tracing of the close contacts was completed quickly, and the World Health Organization has described contact tracing as the bedrock of outbreak response. And we've seen firsthand over the last couple of weeks the impact of effective contact tracing in trying to break that chain of transmission of COVID-19. The recent clusters have also demonstrated the importance and effectiveness of personal protective equipment. And the results of the recent situations could have been very different if individuals, including healthcare workers, were not wearing personal protective equipment. I'd like to thank everyone involved in addressing the recent clusters of COVID-19, including staff at the QEH lab, Island EMS, testing clinics, the QEH emergency department, public health, and staff in our office. And they have worked tirelessly and with many hours, so thank you all. Despite the resilience and strength of our seniors, we know that COVID-19 has been very difficult for seniors and others in care facilities and for their families. It has been a challenging time for all, and particularly for family members who are used to visiting and caring for their loved ones on a daily basis. And as we've seen over the last number of weeks with increased outdoor visitation and then indoor visitation, we would like to carefully increase visitation and contact between long-term care residents and their loved ones. So discussions are underway, as the Premier mentioned, with Health P.E.I. and long-term care providers across the province about the possibility of designating family members or loved ones as an essential care provider, allowing long-term care residents to go on drives or visits with family members, and increasing visitation overall. And this would include closer contact as long as personal protective equipment was being used. And so this is going through the process in the days ahead. We will have more to say about this long-term care visitation and contact, I think, and I'm sure Marion will be speaking about that in the days and week ahead. Since the Atlantic bubble started on July the 3rd, a total of 29,839 vehicles have traveled to P.E.I. The majority of those, of course, via the bridge and some via the ferry. So it's actually a total of 64,000 individuals who've traveled to P.E.I. since the bubble started. And last weekend saw over 5,000 vehicles cross the Confederation Bridge. Every one of those vehicles was screened upon arrival in Borden-Carleton. Since mid-April, a total of 289 individuals have been denied entry, and the reasons for refusing entry include people lacking travel pre-approval when it's required, or people wanting to move to P.E.I. without a plan or any documentation, or failure to produce the necessary identification. Since the pandemic began, in P.E.I., 17,624 COVID-19 tests have been processed, including over 2,350 in the last week. And P.E.I. ranks third in Canada in terms of COVID-19 testing per capita, and we're behind Alberta and Ontario. So we are conducting, at this point, 108 tests per thousand, compared to the Canadian average of 94 tests per thousand. In terms of operation isolation, there are currently 753 individuals in self-isolation, and 6,689 have completed self-isolation to date. In terms of enforcement, Justice and Public Safety have issued 138 warnings to people, most for failing to self-isolate, and they have completed a total of 382 visits or compliance checks. 34 charges have been laid, with fines starting at $1,000. And thank you to the majority of Islanders and visitors who have self-isolated exactly as required. In terms of COVID-19 inspections, as of July 20th, there had been 829 routine COVID-19 inspections conducted, with the majority being satisfactory. And unsatisfactory inspections typically are related to not having or following an operational plan. And we have received 30 complaints related to businesses or in our organizations, and 19 are resolved. The cluster of cases in the past 2 weeks have confirmed that COVID-19 is and can be in our province. The virus presents a threat to our community, and we all have to remain cautious. We should look at the recent cases as a warning signal and a reminder to keep our circle of contacts small and to avoid unnecessary risks. As Islanders, we've been willing to adopt public health measures, including physical distancing, staying home when we're not feeling well, keeping our contacts small, and wearing a mask in indoor spaces when physical distancing is not possible. And together, our collective action has been effective in keeping the incidence of COVID-19 in P.E.I. low. As recently noted by the Public Health Agency of Canada, we should consider the public health measures as layers of protection against COVID-19, and each layer is an important safeguard. Together, these layers of protection are our best defense as individuals and as a community in this global pandemic. We mentioned earlier about the increase of, in terms of cases that are in the less than 39-year-old category. So if you are in the 20 to 30-year-old category, if you know someone or or have a family member that is 20 to 40 years old, please remember to try to keep the number of contacts small and be safe. If any one of us was asked to identify how many contacts we had in the last few days, if we were told we were positive with COVID, how many people would that impact? How many families would that impact? And it's good to think about that kind of effect it could have. The Premier mentioned being grateful, and we've talked about it before, how grateful we are to be in this province. We're grateful for our healthcare providers, grateful for our staff, grateful for each of us who have worked together in the last number of months to respond to this global pandemic. And we are able to get together more than we did a couple months ago. We're able to eat at restaurants. We're able to go to drive-ins. We're able to go to the beach. We're able to start visiting in long-term care. And so I am grateful, and we are really fortunate to be here in Prince Edward Island. So as we enjoy another beautiful day in Prince Edward Island, let's continue to look out for each other and be patient, be caring and kind. Thank you.
Good afternoon, everyone. This is another week to be grateful for the dedicated and expert work of our Chief Public Health Office and our health system staff and physicians. I'd like to thank the Premier and the Department of Health and Wellness and Government for their support and trust in our system and our people. I want to say thank you to all the staff and physicians who've done an excellent job of limiting the impact of the recent outbreaks. In our Health P.E.I. lab, our testing sites, including Island EMS, our hospitals, and all of our people have been working extremely hard to complete the appropriate testing and ensuring the proper protocols and personal protective equipment is in place and being used. These efforts are ongoing as we remain ready to contain this COVID-19 virus. We're very pleased with the results of the testing completed and announced today, but we are maintaining precautions that were put in place last week for this current week at the Queen Elizabeth Hospital. As a reminder, this includes some restrictions on visiting at the QEH, which are limiting visitors only to the areas of pediatrics, intensive care, labor and delivery, and only 2 designated visitors will be permitted in these areas. Additionally, 6 visitors may be designated for those at the end of life, and compassionate exceptions will continue to be made. Patients are allowed to bring a support person with them to their appointments at the hospital. We're asked that anyone coming to our hospitals or clinics for any reason to please bring a mask and wear it, as recommended by Dr. Morrison for all of your public spaces where physical distancing is difficult. We have strong screening procedures and personal protective equipment protocols in place, and we want you to know that every step is being taken to keep everyone safe and stop the spread of this virus. Our hospitals and health services are available, and they are safe for you to come and seek care. We do require patients who attend the emergency departments or psychiatric urgent care centers to provide and to province-wide to wear a non-medical mask when coming to seek care. If you have an emergency, please visit the emergency department nearest you or call 911. If you're in a mental health emergency, call 911 or visit the psychiatric urgent care center at Hillsborough Hospital or the Prince County Hospital. Islanders can call 1-833-533-9333 and select option 4 to speak with a trained mental health professional who will direct you to the best service for you. You can also visit the Government of P.E.I. COVID website and select mental health services to see a full list of available resources. The Island Helpline is available to you, as are our mental health walk-in and call-in clinics. Please attend to your health seek care when you need it, come to your appointments, and bring a mask if you can. Thank you.
Thank you. Now I think we can turn the floor over to some questions from our friends in the island media.
Shane Ross, CBC.
Hello. I was wondering, can you tell us a little about the role of the Brudenell Resort in providing self-isolation facilities?
Sure, I'll start. Sure. Okay. Hi, Shane. So the Rod Brudenell facility is it's managed by the Transportation Infrastructure Department, if it is being used for our temporary foreign workers, as well as for other needs, but particularly for our temporary foreign workers. And we work with our partners and collectively we work with other parts of government to make sure that temporary foreign workers are safe and healthy themselves and protect their co-workers and protect islanders, and make sure they have a place to self-isolate before they go to their employers. And that guidance and details around that guidance, Shane, are in a guidance document available on the website.
And I would just add to that, it's Dennis, Shane, that we have been working with a number of departments and certainly under the direction of CPHO to provide lodging for those who can't easily or safely isolate. We've done it for truckers, for example. We've done it for if individuals are coming to the province and they haven't demonstrated a self-isolation plan, we've made facilities available. And as you know, there's been lots of talk leading up to earlier in the spring about temporary foreign workers in the region. And so we've been providing that lodging in partnership, as Dr. Morrison has said, with CPHO, other departments, and also the private sector in Prince Edward Island.
Oh, okay. And so I understand somebody was arrested there for not self-isolating, or allegedly. So can you tell us about the precautions that are in place now in the jail to protect staff and prisoners now that a COVID-19 patient is housed there?
Corrections really has been making sure that any person that comes into their facility is treated as a possible COVID patient, in the sense that the precautions are in place, and they have a very good plan in place. And there's certainly there is no one who is positive currently at the correctional facility.
Thank you. Julien Lecacheur, Radio-Canada. Julien Lecacheur, Radio-Canada. François-Pierre Dufault, Radio-Canada.
Good afternoon to you all. Question pour vous en français, Dr. Morrison. Par rapport à l'incident qui est dans les médias aujourd'hui, on parle de cet individu qui aurait été arrêté à Brudenell après ne pas s'être isolé. Vous avez mentionné aujourd'hui que la majorité des insulaires respectent les règles, se sont isolés de la bonne façon, et c'est pour ça qu'on a les résultats encourageants qu'on a aujourd'hui. Dans des cas particuliers comme ça, quand vous apprenez qu'on doit amener quelqu'un en prison parce qu'il ne s'isole pas, comment vous réagissez?
On sait que, comme vous avez dit avant, la majorité, les insulaires et les visiteurs auto-isolent, ils font isoler très, très bien. Mais si on a des cas qui ne suit pas les règles. On a un système pour les identifier. Et puis, en ce cas, c'est qu'on a fait. Et puis, on a mentionné la semaine passée, on a eu des personnes qui n'ont pas ont aussi eu les charges avant pour ne pas auto-isoler. Et puis sont alors on les trouve et puis parce que on pense qu'ils vont mettre les autres insulaires à risque. Alors ça me décourage un peu, mais on sait que on fait les choses, on a les systèmes en place ici à l'île du Prince-Édouard que beaucoup de les autres provinces n'ont pas. Et c'est beaucoup de travail de protéger tout le monde et on fait notre mieux.
I have a question for Premier King, if I may. You mentioned right off the top today that a Canadian bubble is not part of your plan. Now, the Quebec government would like the Magdalene Islands to be part of the Atlantic bubble, and they are sending requests to all 4 premiers of the region. Today, you might have gotten it already, or if not, you'll be getting it soon. I'm just wondering what's your take on that. Should the Magdalene Island be allowed into the Atlantic bubble at this point?
Well, just let me clarify, Francois. I said that expanding beyond the Atlantic bubble would be something we would look at only later on. There are other jurisdictions, as I stated, that might look to go a little bit sooner. And in conversations that we've been having daily with Dr. Morrison and her staff, we would like to follow the same process we have been following, and that is to follow the best science and data and research that we have to make sure that our system is able to deal with an influx of people. So that will continue. So in terms of the Magdalene Islands, I haven't received that correspondence as of yet. I do know that there was inquiries from other parts close to Atlantic Canada about looking to expand the bubble, but we'll be having a call again this evening with Atlantic premiers, and perhaps it will be discussed at that time. But until such time as we have a more fulsome discussion, I would probably reserve judgment or thought on it until that time.
Thank you.
Alison Jenkins, The Guardian.
Yes, hello. We have confirmation that a person entered the province via the bridge after their application was denied. Just wondering how they were able to enter the province without being screened or sent back.
I mean, Alison, I'm not sure. I mean, I think if there's any concern, it should be identified, and we'll be following up. As you know, there's a pre-approval travel process for anyone coming from outside the Atlantic bubble, and they are screened at airport, ferry, and bridge, and so I'm not sure about the case that you're referring to, but if there's any concern, then we should be following up, and we will.
Okay, thank you. And how does the Confederation Bridge decision to lift their inter-provincial travel restriction impact the screening on P.E.I.?
So I think, as the Premier mentioned, I think there's still discussions ongoing about the restrictions and when they may lift restrictions in other provinces, and ongoing discussions with our province too. But we have a self-declaration form, for instance, for anyone coming back into P.E.I, and it includes on there, have you been outside the Atlantic bubble? Have you been in contact with anyone, a close contact of people who have been outside the Atlantic bubble? So we have some of those questions that are part of the self-declaration form, so they would continue if the other provinces lifted and changed their travel restrictions, but we would be making sure that we continue to ask those questions.
Okay, thank you very much.
Stephanie Van Kampen, CBC.
Hi, I have a question for Premier King. In relation to opening up PEI to family reunification from across Canada, are you aiming for a particular date with that? You mentioned it would include 2 weeks of self-isolation. So just wondering if you could give us more specifics on that, what that would look like.
I would, thank you for the question, Stephanie. I would think that we would like to be doing that as soon as possible. We will let the sort of Chief Public Health Office deal with the what changes we might need to make to the application process, for example, but it would be our intention to do so sooner rather than later, realizing that, you know, it's the 21st of July, so summer is slipping away.
So do you have a particular date in mind?
I might, I don't, I'm just looking at Dr. Morrison to confirm, but I would.
I mean, I would think it would be as soon as we can get some of the logistics worked out. So it would be hopefully in the days ahead. Yeah. So as soon as we have a date, we'll let you know.
And just to be clear, that would require them to do the 2 weeks of isolation?
Yes. Just like people who are traveling here with pre-approval from outside the Atlantic bubble for many other reasons, that they have to self-isolate for 2 weeks.
Great. And I have a question for Dr. Morrison in relation to long-term care. Just wondering if you can give us some more measures exactly what you're looking at for long-term care. You mentioned allowing seniors to go for drives with family. So would that be up to individual long-term care centers to enforce and allow those measures, or would there be more of an overall approach? Wondering for some more specifics.
Well, I think some of those specifics are exactly what they're trying to work on and make sure that the policy is clear and gets approved through Health P.E.I, but also through the private long-term care facilities. And so that's an ongoing discussion that will happen in the days ahead. And certainly the private long-term care and public long-term care, that they'll be certainly all have access to the same policy. And but as we've seen with some of the other visitation policies that we've already put in place in terms of indoor and outdoor visits, you've seen some facilities go a little bit more slowly than others, and they're trying really hard to balance the safety of the residents, the family, the staff, and but recognizing the need for that connection with loved ones. And we've talked about that at different times here, and that conversation is an important one to continue.
Thank you.
You're welcome.
Marine Arnaud, La Voix acadienne.
Oui, bonjour. Question pour vous, Heather Morrison, en français. Est-ce qu'à l'île du Prince-Édouard, on peut parler véritablement de vague de Covid, étant donné qu'il n'y a jamais eu de transmission communautaire?
Oui, bonjour. On n'a pas vraiment eu une grande vague, première vague, mais on est inquiète un peu qu'on peut avoir une deuxième vague dans l'automne, mais on ne sait pas. Mais on fait ce qu'on peut pour diminuer le risque de transmission communautaire maintenant et dans les semaines qui suivent. Alors, j'espère que tous nos efforts vont faire une différence pour peut-être éviter une deuxième vague, mais on ne sait pas à ce moment.
Et est-ce que vous pouvez réexpliquer en français ce que vous avez expliqué en anglais à propos des long care facilities?
Je pense que quand on commence les discussions et la direction pour avoir plus de visites en nombre de visiteurs, le contact, d'avoir peut-être les visites pour amener les résidents pour conduire pour les visites chez la famille. Alors, ils sont en discussion avec Health P.E.I. et les autres départements, ou les autres facilités pour long-term care. Alors, c'est important discussion d'en avoir. On sait que c'était tellement difficile pour les résidents et les employés de long-term care. Alors, j'espère qu'on peut annoncer les dates, les détails dans la prochaine semaine.
Merci beaucoup.
De rien.
Carrie Lynn McLeod, Ocean 100.
Good afternoon, folks. I just have a couple of questions regarding the case that has become public today and the arrest of this gentleman who's now in Hollow. Dr. Morrison, can you tell me how was this case discovered? Was it following travel outside the province, or was it found out by because of contact tracing that has been done in the last couple of weeks?
So, hi, Carrie Wynn. Sorry, just trying to make sure I could hear your question. So, we have talked about our cases, and we've already given a lot of detail, or as much detail as we can in terms of the cases that we've had in Prince Edward Island in the last couple of weeks. And we, as you know, we've identified them as either related to travel internationally or outside the bubble, or close contacts of a case. So we have spoken about that as a group of cases in the last 2 weeks. And so that obviously this case was previously identified. It is not a new case. So I think that's we've it was identified not through public health, obviously, but for other reasons through the justice system.
Okay, and should others that have been at Rod Food Mill Resort be concerned, like staff, patrons, other guests?
No, absolutely not.
Okay, thank you.
You're welcome. That's it.
Okay, well, thank you very much to our friends in the media, and to Marion and Dr. Morrison. Thank you, and we'll chat again.